Okay, Kristen, why don't we get started? We might have a few stragglers. That's okay.
All good. Yeah. Thank you all for joining us. We're really excited to have this discussion today on transforming healthcare communications with brand journalism. And we are the team from Ragan Consulting Group. So I'll be your host. I'm Kristen Hart, VP of Sales and Marketing here. And we're going to dive into this concept of brand journalism, the approach, the content approach to take, control of your narrative and share expertise and engage your audiences internally as well as externally, in a new and an effective way, kind of becoming the media for yourself. Today is a very casual, open conversation. We're going to have about 15, 20 minutes of presentation time, and then really want you all to, join in the conversation as well. We're calling it the coffee and conversation, but not everybody drinks coffee. So maybe you have tea or water or Theraflu, hopefully not, but whatever you're drinking today, please enjoy the conversation, if you will. And before I introduce our speakers, I want to tell you a little bit about our organization if you're not familiar with us. As Ragan Consulting Group consultants, we bring in experts from all around the US that touch on all areas of communications. Today we have Steph Johnson, of course, and Jim Ylisela talking about this area of our business. But all of our specialists and experts and consultants offer custom solutions to all of our clients for internal and external communications. And we do communication audits, custom consulting programs, and tailored training and coaching for your teams. So we do this with a wide range of industries and organizations. So we've seen a lot of different challenges and help our clients through that. But today we are here to network, we're here to learn, we're here to, kind of hear from other peers in your industry, but happy to help you at any time. So if after today you are looking for an opportunity to meet one-on-one with Steph or Jim to get some, coaching and pick their brains a little bit about this topic or anyone else, we're happy to set that up and happy to help you in your journey for content. I'll be on the chat, so if you could put in just to kind of get the conversation going, let us know where you're joining from. Where is your office or home office today? Give us your city location. And if you have questions throughout the presentation, just send them in there or raise a hand, and we'll kind of keep the conversation going and open it up for the chat after. Hello, Chicago friends. Everybody here in Chicago, a lot of, oh, Huntley, my parents live there, Kelly.
Oh.
There all the time. The Algonquin shopping is fantastic. So, so I encourage you to do that. Keep us, keep the conversation going throughout the day. So let me introduce our speakers for today. Steph Johnson is Chief Communications and Culture Officer at Color Group. She has a background in media, integrated marketing, public relations for more than 2 decades. Stephanie is an Emmy Award-winning journalist, and she has held significant roles at prominent organizations such as the American Cancer Society, American Medical Association, and she's developed several successful communication strategies, programs, and executive thought leader platforms throughout her career. So it's a pleasure to have her joining us today. And Jim Ylisela, our co-founder and our senior partner here at Ragan Consulting Group. He's also an award-winning Chicago journalist with experience in communications research, consulting, and consulting many of our brands through brand journalism, storytelling, and the good content creation that we need. Together, they will share some insights today from their previous collaboration, working with Advocate Aurora Healthcare, launching our very first brand journalism platform years ago, and all of the work that they have done since. So happy to introduce you both, Jim and Steph. Welcome in.
Thank you.
Thank you. Thanks, Kristen. Hey, Tim.
Tim made it. Hi, Tim. We go way back.
Way back.
Way back.
And I see Katrina is on as well. Katrina Barker, hello. Thank you for joining. I'm going to share my screen so that we can, get this party started. All right. Hope everybody can see this.
Mm-hmm.
Okay. So we're going to take a talk for a little bit, not too long, because we really want to hear from you and what's going on in your shops. This is a crazy time to be a communicator. It's a great time to be a communicator because there's so many tools and methods and so forth, but it's very crowded out there. That's one thing that got us started on brand journalism a dozen years ago. It's also, what's happened in the news media over that same time period. Consolidation, layoffs, newspapers folding. The state of media has changed quite a bit, which is another reason why, you have to tell your own story and tell it better and make sure that you get it to your audience, with or without media support. So I talk a lot about newsrooms. I love newsrooms, but just wanted to kind of talk a little bit about what I mean by that, because I really mean three things. I think a newsroom is a kind of mentality, sort of a state of mind with a group of people in an organization in the communications department that are thinking about news and stories and information and analysis and all the different types of content in a particular way. And it's an approach to doing that is more storytelling than PR, more storytelling than marketing. We'd like to say a lot that brand journalism is kind of the third way to get the word out. Marketing is good, PR is good. Those are good disciplines. This is kind of another way to go about that. A newsroom could also be, the place where you put all this stuff, a digital platform, a web presence, and we've helped organizations create these in healthcare and other disciplines, including our very first one at Advocate Aurora Healthcare, which Steph's going to talk about in a minute. And then the other thing is the team, the newsroom team, and these are folks who again have that sort of state of mind, but come together to talk about the best way to tell stories. Not just we got to get stuff out the door. I mean, communicators are tired and inundated with all of the things that are coming at them from the top of the organization and elsewhere. This is an attempt to say, okay, we're going to get a little more handle and more control on what we do with news and information, and as a team, we're gonna do that together. So that's kind of how we go into this. And speaking of getting together, Steph and I got together. My God, I can't believe it! In 2012, to pursue a big idea. I must have been a mere child in 2012, Steph.
Yes,
Yeah.
quite young.
Yes. Yeah. Thanks for jumping in there and Steph, I went back into the archives
Whoa.
since I never throw anything out, and I found this from September 6, 2012, when you and I gave a presentation to the Advocate leadership about doing this. Talk about that.
That is crazy. Tim, Nikki, I think you both were at Advocate at that time. Am I right?
They were.
Yeah, you're right. Yeah, absolutely.
Yeah. Do you remember us starting way back when? Yes, this was when brand journalism was becoming a thing. And Tim and Nikki were a part of our communications, marketing and communications team at the time. But we wanted to do something different because Advocate Healthcare at namely Advocate Aurora right now, was very matrixed. And we were in a situation where, as Jim mentioned at the outset, many of the media conglomerates downtown were consolidating. There weren't people driving out to Oak Lawn, driving out to Oak Brook to be able to meet or greet or be able to get our physicians and experts on the record. It was really easy for them to go to a Northwestern, University of Chicago, that were really in their backyard. And we wanted to do something as an organization, as a brand holistically, that would allow us to be able to put our experts in front of media journalists when real-time news was happening. And that was the basis of our plan, to be able to be more in front of them so that we could get more opportunity and more visibility that advocate leadership was looking for. So we created this idea of creating our own newsroom, brand journalists and so forth like that, so that we could actually push news proactively. And when we were here about breaking news, we would actively reach out to reporters before they could even contact anyone, so that we could try to put an expert in front of them. And it was a novel idea, a concept that leadership wasn't really familiar with, didn't think would work. And so we had to do some building blocks and work collaboratively with Ragan Communications. That's who we brought in, and Jim in particular, to be able to actually bring the concept to life and be able to show it to leadership. And when you think about brand journalism, but even before we move on and continue to talk, there's so much that has changed, because I doubt everyone on this phone has heard of brand journalism. But since COVID, there's been such a change in the way that communications has happened and continues to happen in organizations across the country, particularly healthcare organizations. And Jim, if you wanted to, I thought it might be good to just even hear about some of those nuances that are happening from some of the folks that are on the phone, pain points and things they see.
Yeah, sure. Anybody want to jump in here? What's changed for you, and what are the pain points out there in terms of getting your stories out?
Tim,
Christy?
yes, it's a different space with news and media now.
Yeah. Don't be shy.
Nikki, do you want to talk about it at Susan Komen? You've changed a bit. You were with me at AMA for a little bit. Do you want to talk about what you're seeing now versus what it used to be?
Sure. So for us, I mean, we're always trying to get our experts out in front around breast health. And we're in competition with big dogs like American Cancer Society stuff, you know.
Yes.
And we're a small but mighty organization, but trying to get experts in front of the news is a challenge, because one, honestly, we don't have a medical expert on staff. That's a challenge. And so we have to find internal folks who are willing to be able to speak about a specific topic. And Komen also is an organization, just a safe space, that's a little bit, you know, it's a little bit more traditional, right? And so having the PR team try to cajole the large organization that's used to doing things a certain way into being like, you ready for this? Let's go for it. Do you have an expert? Do you have an expert in community development who can talk to this? Well, I don't know. I'm nervous. We have to go through reviews. No. We don't have time for that. That for us is a challenge. It's, you know what I mean? Just trying to get them like ready and ramped. And we've done media training and all those things, and they're still really resistant. So I don't think they understand the urgency of that time piece is really, because we're trying to beat ACS half the time, right?
Yes.
They're the go-to source. So we've got to be sexier and smarter and quicker, but that's a huge challenge for us. And, you know, just trying to kind of beat the competition. And it's hard. It's really hard. And we've prepped people, and I try to encourage them to think outside the box and ways to pitch a story. But even that's challenging. So that's kind of what we're up against.
Yeah, I mean, we see that in a lot of organizations, Nikki, healthcare and of course other organizations, because we've been all doing it the same way for a long time. So it's, we write press releases, we pitch stories, um, we put content out there, but we're not exactly trying to, go direct to our audience. And that's one of the concepts of brand journalism, of course, is we're not leaving the media out of it, but we're going direct to the audience through social, through our news hub, through our, newsletter, send out the headlines, have people subscribe, because that's the way to reach that audience. And just the whole concept of pitching stories, Nikki, that you mentioned, who are we pitching to? I mean, in some cases, we have friends, still work at the newspapers downtown Chicago, and they might be covering 5 beats these days. There's no one who necessarily is, dedicated to one area or can really spend the time. And so they're chasing news because they have to, but all the stories that, would be worthwhile, but maybe aren't necessarily breaking news, they don't have time to do. So, and Steph made the point about Advocate, is that, we pretty much decided, Steph, that, if they weren't going to come out to the burbs, we were going to have to take the stories to them.
Yes, and one of the great ways that we're going to do that, I love that you have this highlighted. I can't believe you pulled this out of some trunk, but that number 2 is huge, because what the concept was basically we needed to humanize our stories and humanize them fast enough to be able to attract the media, which many outlets, really the B block is way down if it's a D block or what have you. And you could do this through brand journalism, not only bring an expert forward, but if you were weaving the story around the communities that we serve in health institutions, we were able to get people to sign, weave the story around the human. And then oftentimes when we pitched the story, we not only had an expert that could talk about it, but often a patient who was willing to come forward as well, share their story, which made it much more attractive for the reporters, because it killed a lot of things that they didn't need to do. We didn't have to lose time, if you will. Time is of the essence when you're in a newsroom. And in order to be able to hit your deadline for this, we were able to then not only bring an expert, but oftentimes a patient they could weave the story around. It was effective because it was community related. And then it allowed advocates to do 2 things at one time: tell the news, be able to be lifted. You had third-party validation through a patient who had a good health outcome, but at the same time, you could also then tell that story in a way that it penetrated in the community, because oftentimes you were dealing with someone who lived in one of the communities that your brand serviced as part of its marketing and service lines and so forth. So brand journalism allowed us to do a lot and be effective and be faster, much faster than we were using before, or being traditional, Nikki just mentioned.
And there it is. That's healthy news from Advocate. Boy, it took a little while to get to this stage, but we persevered. There was no such site at Advocate. This is built from scratch, and news, features, recipes, all videos, everything you would want in one place. And that's the other thing. I was looking at some of the sites, some of your sites, some of the people who signed up, and a few of you still have, there's a newsroom with a bunch of press releases, and then there's a blog. And boy, I remember we had this conversation all the way back when, because I kept saying, let's put everything in one place. The blog stories are often better than the press releases most of the time, I would say, because they have that human element. This is Endeavor, which is the brand journalism site for the Moffitt Cancer Center. We work with them. And one of the things for each of these sites, Steph talked about the business case for Advocate is to, be better known, get their experts out there, take the stories, to media rather than waiting for them to come. Endeavor also had a very particular, kind of business case because they wanted to, elevate their reputation with some of the big national cancer centers like MD Anderson and Memorial Sloan Kettering. And that's was part of the motivation for creating Endeavor, which is, going strong today. I won't, read through all of these. We'll send you this deck, but basically, we've talked about this. Everyone's a publisher. You are publishers of information that people actually, want. That's why healthcare is so great for brand journalism, because the stories, attract a wide audience. They're things people want to know. And the main principle of creating the content was, less about you, more about them, which is kind of the opposite of PR and marketing. But, just again, not another way in. And, to put that newsroom together, and to use journalistic techniques of, good reporting, good storytelling, humans, all the things that you all know how to do as writers, and use all the tools available to get the word out. Social has become so important in getting the word out and giving people those chunks of information, allowing them to come back and get more, and to make sure that we measure the outcomes. Here's just a look at a few others that we've done. Cape Cod Health News, right on the Cape Cod Healthcare. We worked with them, and during COVID. Steph mentioned COVID. During COVID, they became the #1 source for health news, particularly about infectious diseases. So it shows you the power of this sort of thing. This is Juice from Baptist Health in Jacksonville, Florida, and they've been doing some really interesting stories. The lead story here, The Pitfalls of Self-Diagnosing with Dr. Google. Very good headline, good story. And then this is Corewell Health, used to be called Spectrum Health in Grand Rapids, Michigan. They have some great photographers and videographers on staff. And this one, they've been doing some great stuff since we helped them launch, gosh, I don't know, 2014 or 15. So you can see all the different, styles and approaches here. And then, the measurement piece of this is, so important. I mentioned COVID with Cape Cod Health News. And, this is kind of what they found. Particularly, you can see that infectious disease line there and all the story views they were getting, because they were the ones that everyone turned to. The Cape radio station turned to them to get the latest news and then put it on the radio. So they became kind of an essential service, which I think is, terrific. And Endeavor, they now have their newsletter that goes out to their subscribers that drive people back to the news site. Great, strong clicks and open rates. But the main thing about Endeavor, which is remarkable to me, and this is, new data from them, is that they are now, the Endeavor site itself is now the second most visited site on the entire Moffitt website, second only to the cancer section of the site where most people would typically go. But so Endeavor has become kind of the focal point, kind of the hub for all news that goes out internally and externally. So there's a lot to do here. Last thing I'll say here is that, you know, that when media get polled about this, they think that the way that organizations communicate or share information with media is outdated. And in 2021, Muckrack found that's like 61% agreed with that it's outdated. The following year, it's getting better. So now it's like 44% think that the information shared is outdated. That's way too high still, but I think it means that we're making some progress in kind of updating how we communicate, not only with media but with the public, with patients, with families, with stakeholders, with funders, whatever the case might be. We're making some progress. I think brand journalism actually has a lot to do with that. Steph?
It does. And I will just say this, as a person who's implemented it at every organization that I've worked at and implemented it successfully, here are the big key things that everyone on here should consider, and maybe we should spend some time talking about as a group. Number one, it's intentional. Brand journalism is super intentional. When I came with this case to present to not only our CMO, but CFO and all the executive leadership team at Advocate Aurora Health, the way that I presented it is it actually helps you with succession planning. It also helps you with your marketing verticals, because we intentionally married the stories that we wanted to bring forward to match each one of the service lines. So Advocate wanted to see an increase around its cardiovascular care. Okay, we're going to have a vertical of stories and blogs that are related to there. Then what does that mean? I need to be able to reach the top 5 cardiologists then across the system at any time in real time to be able to get them online, on news, in front of camera, or what have you. So we started to do that and build that. And then I repositioned my newsroom, the people that worked with me, and then matrix to me at all the sites to mirror that. So then we had a cardiovascular team who then just got more smart around writing. And then they were the reporters that inside the institution, they became reporters on the team, or the beat leads that then covered our cardiovascular. Same thing for Neuroscience Institute. We wanted our stroke center to be one of the top ones in the Illinois and Wisconsin, that blueprint of moving outside of that. So then we got really smart about making that be a vertical. It also then allowed us to be able to have diverse voices across that. Nikki just mentioned that. It's so important that if you wanted to report to Telemundo or what have you, if Advocate was then telling me these are your top 5 leaders, then I could look at those and say, okay, if any one of them needed to speak Spanish, or if we had another way to be able to, a big story that broke somewhere else, who would be my go-to person? This cut time out. We were able to have speed dial to Dr. Buffalino and some of the leaders that are still leading Advocate and have grown on and amassed amazing careers. So it helps you with all of those things. So it's not just the newsroom and how you do it. The way you set it up is very intentional, and it also then supports everything. The visibility then drives more people to the website. Then, of course, it ultimately leads to more patient and then ROI. But then the stories then have a point of view. So then as we set that up, matrix across the system, it made it easy for people then to know who the reporters they needed to tap for cardiovascular care. If we were talking about outpatient, if we were talking about just us as an accountable care organization and building one of the largest systems. So that is the way a brand journalism platform can be the heart of an institution, the heartbeat, the cadence of what I called it. And I've done it in everywhere that we've gone, and just so excited about this call because these are the people that I love, the healthcare journalists. We have a lot of sick people in this country. So these stories are important, and I'm glad we're having this conversation. Thanks.
Thank you. I want to kind of open it up to everybody. One of the other, let's talk about barriers. One of the barriers that we've come across from time to time is, the traditional, as Nikki was saying, people doing things traditionally, and that was traditional in communications as well. PR people wanted to be PR people, right, Nikki? You know, we're gonna write a press release. Well, why don't we do the story? And just, you know, and just do a great job on it. And then we can pitch the story, or we can post the story and people will pick it up. I've had so many of those discussions. You know, the marketers, they had a plan, they wanted to do their marketing, which is fine, but you know, in so many organizations, they felt like when social became very important, they're like, well, no, we own social. And Nikki is laughing. She's experienced all of the, you know, we own social, and we've got our entire social calendar set for the year. And I was like, how could you do that? The news happens all the time. Social needs to be part of the whole editorial structure, not siloed like this. So, you know, some of the issues involve the communicators themselves, and I don't know if Nikki or Tim, if you remember some of those first meetings we had at Advocate, and everybody was kind of looking at me like, "Who is this guy, and what the hell's he talking about?" Tim, I think you recall that.
I do.
But Tim, can you talk about that first story you wrote, the one
Yeah,
about your brother?
I still remember it, Tim.
Oh, wow.
I don't remember the first one.
We remember your story better than you do,
I
apparently.
guess.
It was about your brother.
Oh, yes. That one's still special to me.
Yeah, it was different. It wasn't anything you had done before. And even remember, it was newer brand journalism. And you're like, okay, this kind of story. And we're like, yes, because it's going to be different. So you want to talk about that experience even for you? Because it was touching.
Yeah, yep. Around the time we were planning this and launching, my brother had a massive stroke. And I ended up dropping everything and going to Minnesota, and was able to write a story on his experience and what I went through, what he went through, caring for someone who's gone through such a huge life-changing event. And it for me, it really helped me. I mean, that was my personal learning, I guess. And I was really happy to be able to share that. So it was just a new way of writing, not the traditional press release, not the email push. I mean, and he was in Minnesota. So it didn't have anything to do with our physicians. It didn't have anything to do with, I mean, I was the advocate connection, but I was still allowed to do that. So it was really special.
Yeah. And the story was personal. It was very emotional. You know, these are the things that people read. These are the kinds of stories that matter to folks. And you know, we're always talking about this in our storytelling and our Build Better Writers programs is where's the emotional center of the story? Wasn't hard to find it in that one, Tim. But sometimes, you know, on the topic, like what will make people care about this? What will make people read this as opposed to the 50 other things they could be reading on the same topic, for, you know, by going on the Google machine. So it's, you know, this is brand journalism helps you kind of stand apart from the crowd, I guess, is one way to think about it.
Yes. And that story made people in that young demographic want to then make sure they were taking their blood pressure, talking to their physician about where their heart rate was, if they had hypertension or didn't. So it didn't matter that he was in Minnesota. It still resonated with that demographic. Like, could I be at risk of an unexpected stroke and not even know it? And that is what became news and became relevant, and then was still something that Advocate could use to lift its services that supported people in that way. So it still mattered in so many
Yeah.
ways. Mm-hmm.
Let's hear from some others. Any particular, I mean, to what extent are you doing this kind of storytelling now, or or do you want to, or what's getting, in your way to do it? Any of those barriers we've already mentioned, or other things? Who wants to jump in here before I start calling on people?
I'd love to hear from Northwestern. Northwestern has always had such a prominent visibility in the downtown Chicago market and even broad. Could you share a little bit about what you're seeing now, what's different since COVID, the whole thing of DEI and social justice, and how that has changed healthcare communications to some degree? Would you mind sharing?
I don't know. Oh, sorry. Go ahead, Kate. You are more versed on this than I am.
Well, I don't know about that. Christy and I both are on our employee communications team. So, we do have a consumer communications team and a media relations team. The media relations team has a newsroom site on nm.org. And then the consumer communications team has a health beat. I know we saw an example also called Health Beat, very similar in storytelling. And then those stories get shared on social media. I think what's changed, and I've heard this from the media side and what they put on their newsroom site, is making things super easy for journalists to flip. So whether that's photography, quotes, videos, they have their own dedicated video team member to put together things that the producers can easily cut and take what they want for their story, for the news. So that's something they talk about a lot. Steph, in terms of your question about social justice, diversity, equity, and inclusion, from the internal side, we've done a lot of work with employee resource groups, things of that nature. And then I'm trying to think, I can't think off the top of my head, but we share a lot of stories around their influence internally, some positive changes that they've made for patients. Our African Descendants chapter noticed that we didn't have appropriate hair care products for our Black patients. So they worked with supply chain and built the process to make sure all of our patients had access to, the shampoo that was most appropriate for their hair. So those are the stories we're sharing internally. I also just had a thought. We do have a blog called Life at NM that's newer, and that's more of a recruitment tool. But again, that's kind of where we would share those stories around, how our employees are positively making these influences for our patients, just to show potential job seekers that information as well.
When we work with internal comms as well as external, it's interesting because these have been very siloed traditionally. And, there are a lot of internal stories that should be external as well. They're just good stories. Part of our concept of a newsroom is that, that the news team gets a shot at all of that stuff. The story about the shampoos for the patients. I mean, I just think that's a really interesting piece. And, the powers that be might say, well, we don't want anybody to know that. But in fact, the fact that you looked at that and responded to it and then changed your policy about it is a great story and something that, should be shared. So whether it's internal, go ahead. Sorry.
Oh, I was just going to say, to your point about, sharing stories that are shared internally, we do have an editorial board where we have representation from internal communications, like our employee communications, world physician communications, culture, consumer, media relations, our marketing partners with their service lines, so we can make sure that we're sharing content across the board. and maximizing those good stories across our different channels.
Yeah, great. Okay.
Beautiful.
Anybody else? Aaron, what's on your mind?
First of all, this has been great to listen to. I'm Erin Gardner, and I'm with Novartis Gene Therapies, but I actually started with Advocate 20 plus years ago. So I think I left 10 years before the newsroom started, which has just like aged me tremendously. But anyway, it's kind of great to hear the latest. And as I was just listening, one thing I was thinking about is, so we started a storytelling collective, and it's an internal group, and a lot of the stories end up being more internally focused. But I think some of our best stories have really come from that group, and so it's representatives across different functions, locations, etc., to sort of like story mine at a real grassroots level. And like the thing that's in common is often the real sort of like human element. And so one of my favorite stories, and it also is what performed best on social, and where we also have gotten interest from we've gotten good media hits as well, is about one of our employees who's in North Carolina, who was a professional ballerina turned biomedical engineer because her father was diagnosed with a rare disease, and she went back to school. So I guess I'm just kind of putting like all these pieces together. And in some ways, I wasn't really thinking about what we were doing necessarily as you're like talking about in the formal sense, and like, oh, we have been kind of doing that. And for me, I'm just part of an organization that's so much bigger that we each kind of have like a piece. And so sometimes just navigating our own internal complexity is like half the battle. So anyway, this is great to hear. I'd say that's sort of where we're at, is just making sure that like one hand is talking to the other, and that you can sort of like make sure that a good story doesn't stop because of sort of like organizational barriers or processes. So as we're also talking, I was just thinking about the speed, which is sometimes what gets in our way as well, is to be like really responsive. You need to have review teams and others who really are also passionate about what you're trying to do.
I love that
that's a great point. Yeah. Go ahead, Steph.
No, I just wanted to say that is just a coup de grace moment for me, because when I went to the AMA, and I was at the AMA about a decade, one of the first things that we talked about was that when we did focus groups about what people thought of the AMA, besides the majority of people that thought it was car insurance or some kind of health insurance, from a membership standpoint, most people saw physicians being concerned about their pocketbooks. And so that just prompted a conversation with leadership about what do you consider a win for the AMA? And that was, if you could have been in the room to hear that conversation from younger, the guard or versus the older guard, wins were the things you typically saw in old press releases. We got $100,000. So-and-so got this. We just got discounts for physicians for this. And I said, so the reason why majority of the press and people think this is about this and money is because those are what you consider wins. What about the other store? What else is it that we do that you consider a win? Well, everything we do for public health and all of the stuff that we, the legislation that passed. So we started to think about news differently, which allowed us to put wins in a certain space, which are most about press releases about this. And we got $1 million to be able to do about that. But if you do that, you then miss the humanizing story, which you want most people to grasp about the meaning of your organization or the heart of it, or what you stand for. So I thought that what you said was so point on, because when you have those silos, you tend to not know at a macro level, what you want to put forward as the win and the external story. And that's a huge way to try to get your institutional leaders to think about what's constitute wins for them and what's meaningful wins for them.
Yeah, part of the challenge here when you start going down this path is, what are you going to do about those silos? How do you tear them down? One of the things that we try to do, and sounds like a few of you are doing this, is to have some kind of central news desk that has representatives from these different units, so that when you're considering story ideas, it shouldn't just be, okay, well, that's a press release, or that's marketing copy, or that's, an event, but looking at it more in terms of, okay, here's a topic, there is an event associated with it. How can we tell that story better instead of we're having a meeting story, or we got a big check story? How do we, and let's put our heads together around that. And then, that's great for the marketing folks. It's great for the, media relations folks, and it's great for the customers, because you figure out a way to tell those stories and to reach those people in a way they actually care about. One of the things we were worried about early on is, would we be able to get the doctors, to give us the time of day? Because they're busy, and, we're looking for their expertise and good quotes from them. But once they got the idea, and they were kind of reluctant. It's been that way in a lot of places. But once they saw the end product, they saw the story, and they saw that it got some attention, and that maybe one of the media outlets picked it up, or somebody wanted to interview that doctor because of the story. But they caught on pretty quickly, and then suddenly they were all, okay, I'm ready. Doctors love that kind of publicity. Let's give it to them.
Can I
Anybody
add
else?
something?
Yeah,
Yes,
please.
Nikki, please.
So just listening to, I think it was Aaron, talk about like sometimes how you have to overcome internal hurdles. So we have a collective newsroom, we all gather, and it's cross-functional. There's multiple areas across the organization that come together. There's a story about a beauty influencer named Jessica Petway who died of cervical cancer because she was misdiagnosed. So, the social team was like, well, we could do a thoughts and prayers post. And I was like, y'all are cute, but no, we're not going to do that. And I remember back to brand journalism, like, I was like, how can we leverage the story? And so the real crux of it was she was misdiagnosed because she's a Black woman, right? And I'm like, okay, well, I'm in the health equity zone. I'm a multicultural marketer. I'm a journalist by trade. So like, how can we flip this story so that it's relevant to Komen? So what we decided to do was put the story on social in the background, like a little Yahoo snippet of the story headline. But we brought in a Komen expert to talk about misdiagnosis and being your own best advocate for yourself, right, as a patient, and what that looks like. And then we set up Komen as the expert. Like, if you have questions about your diagnosis, please call the Komen Patient Care Center, right? So it's just figuring out ways to leverage what you have based on what's the news is also, like, brand journalism definitely teaches you how to do that. And just how to think outside the box. How can we connect this to what we do? How can we make it relevant? How can we leverage our expertise and our brand? So just want to kind of throw that out there, because I'm still using it, even though we don't have a formal brand journalism site. I still use those skills and still flex those muscles because it's still relevant.
Yeah. Kelly, you had your hand up.
Yeah, I mean, I think, Nikki, that's a great story. And I'm a completely different function than most of you all. I'm program director for patient communications at Northwestern Medicine. This has been interesting to listen to, even though it doesn't directly relate to what I do, but just hearing your thoughts about health equity and, pulling these patient related stories. I'm just curious, do any of you have a patient comms function where you work, and how do you approach health equity in do you work with anything with patient facing communications, and how do you incorporate health literacy, health equity, and all of those pieces into your communications?
Anybody want to take that one?
I mean, I can, but I want to open the floor to someone else.
I'd love to hear what you have to say, for sure.
And I have something to add too on that, because one of the first stories we did, Nikki, after you get finished, was nurses who had to go into some of the not so safe parts of Chicago, and that story became a CNN story. So I'm gonna, Nikki, you probably even remember it.
No,
So,
yeah, I remember that's where you go, and then I'll go.
Yeah. So that was a way that we bridged your work with what we did at Advocate, and to support your your particular function within a health system. So we had a couple of nurses that we knew that were on the west side of Chicago. And what most people didn't know, or what we learned, is that Advocate paid for retired officers to be able to escort nurses and PAs and care managers into neighborhoods because they were afraid. Sometimes they would be in danger because they were carrying medication, expensive medical equipment, or what have you, to homes that patients couldn't leave. And so that particular story caught that we just shot a regular old, I remember Vince Pieri, I think, shot a picture of the officer on his phone. And that story was covered by Sanjay Gupta, and that the nurses were trailed over in that piece, and it ended up lifting what it is that nurses have to do just to get care to people in areas that are riddled with gun violence. So it raised the advent of gun violence. So next thing we know, the mayor is talking about this, and they're tapping this story. Advocate, got lifted because of what it was doing with working with retired officers who then volunteered their time. And the officer and the nurse both end up getting interviewed by CNN. So those stories, most people don't even know about it, but those are the pearls and the ways that you could talk about effectively how the health institution is helping, not only provide care, but how they even care for their employees. So that's a win and a touching way to even have HR talk about how that Advocate takes its work seriously. So it began to be a story that had all of these elements, and that was beautiful. Nikki?
I remember that story. That was a pretty incredible story. And that is one way to leverage it. I think for us, I think it's about, and Jim and Steph both said this, it's about that human connection. Health equity is a term that people throw around all the time, and nobody knows what the hell it means. They don't get it. But if you can figure out a way to tie it to a human story, like Jessica Petway, and the fact that she was misdiagnosed means, as a Black woman, when she goes into a provider's office, she's not going to be respected. She's not going to be listened to. And so we have a chance to say, you know what, you as a patient may have to actually speak up for yourself. So it's finding ways to make those human connections so that people get and understand what's at stake. I think also too, from the other organization that I came from, which is Rush University Medical Center, and I was responsible for D&I communications. It was about a strategic imperative that the C-suite was really engaged with, and you have to have that high level commitment and buy-in, and it's top down, and then the organization, right, it's spread throughout the organization. If you don't have that, then it's kind of hard to constantly message, because people are like, oh God, not health equity again. Yes, health equity again. Yep, we're talking about it all the time because it affects a lot of the care that people receive, especially those in the margins. So we're going to talk about it, but find interesting, compelling ways to do it, find ways that people can connect to it, and then you can kind of sort of slide in the messaging around health equity and why it's so important and why it's so necessary. I don't know if that helps, Kelly, but it's kind of the way we do it.
I was just curious to hear your experiences. I don't work with our media team a whole lot, but we did have one set of stories when we added X to my chart back in December. That's one place, as Kate mentioned, we have an editorial board, and that function really worked for us because our media team picked that up, that change up, ran with it, and we got a lot of great stories from that change because we were one of the first, if not the first, in the Chicago area to add it. So we were able to to get the story out that we've got that option for people who aren't comfortable choosing MRF.
Yeah. I wanted to ask Katrina if she would be willing to talk a little bit about Planned Parenthood Utah. Talk about being in the news. How are you handling the very public national debate over reproductive rights?
Hey everyone, can you hear me?
Yeah.
Okay. Apologies, I'm sort of multitasking and walking on the treadmill, so I'm a little bit out of breath.
It's all right.
No, we're good. Thank you for asking. So I mean, so just for a little bit of a backstory, I worked for Planned Parenthood Utah starting in 2016 until 2022, and then actually went to the national office for a while, and now I'm back at Utah and where I live. And it's always a challenge, and I think the thing that I really am thinking a lot about and why I joined the call today is because we are really trying to remind folks that we are a healthcare provider first and foremost.
Yeah.
That is our mission, and the political side of Planned Parenthood's work only exists in order to protect the ability to continue to provide healthcare. And so as I'm approaching looking at our strategy here in Utah, I'm really trying to look at ways to talk about our healthcare. And one of the things that we've been doing is expanding some of those services. So we're doing expanded cervical cancer treatments this year. We now are offering PrEP for patients. So those types of stories are what I'm focusing on. Obviously, the abortion piece is always a part of it and something we feel super strongly about and are continually fighting for, and also talking about and lifting up storytellers, finding patients who are willing to share their stories. But these other pieces of really critical healthcare are so important to the Planned Parenthood mission. And Planned Parenthood fills a really unique hole in our healthcare infrastructure for folks where we can provide really no cost sometimes and low cost care to folks who often don't have any other healthcare provider. So those are the things that I'm thinking about, and it's been really helpful to hear some of the other stories told here today, and getting my wheels turning. So I appreciate it.
Yeah. I was looking at your site this morning, and I mean, I think you make such a very good point. You know, Planned Parenthood does so many things, and that's not the story that gets told. So when I look at your website, I'm thinking, okay, so where's the best place for that story? Who should, what are the different stories we can tell? And it's a balance, isn't it? Because you also want to tell everyone that, in Utah, you can get an abortion. You have to balance, what's in the news, but also, to your point, all the other work that you do. And that's been true across the board, that Planned Parenthood's never gotten the same amount of attention or storytelling around the fact that in some locations, it's the only health care accessible for women's health. And I think that's just a great opportunity for you to tell better stories. So thanks for sharing that. Before we go, I just wanted to ask Kathy Lucas is on the call. Kathy and I worked together at Metropolitan State University of Denver, creating a site. And I asked Kathy to join us because it's not healthcare, but hospitals and universities, Kathy, are kind of similar in how they're structured and any of the things we're talked about today resonating with you?
Yeah, I would say, and I've always thought this, that, universities and hospitals are so similar because you have doctors, you have faculty, you have students, you have patients, and you have a very complex funding system that you have to explain in very digestible ways. So yeah, I began working with Jim. I was trying to think when people were like saying 2012, I think it was maybe 2016 that we started working together, Jim.
Maybe.
Yeah, and I started my own company about 3 years ago. But so I was really intrigued with the thought of brand journalism for many reasons. But what it led to, Steph, you mentioned kind of that vertical, the other verticals. Well, what really helped with brand journalism, with what I did with my team and with Jim and his team's assistants is, we kind of created not only a newsroom, but it became more of a communications philosophy, is how I would characterize it, where we would get content, and that content, what I loved about it was it would just be repurposed. So we were doing an ad campaign, we would take stories from there, and those, not only would they, be great stories that are running on the newsroom, these then became subjects for our advertising campaign. So it was really, and it was funny because it really worked. We would do a brand audit every 3 years. And once we had implemented a brand journalism program, our advertising budget really decreased. And so we do a brand audit and people would say, oh yeah, I see you all the time. Your ads on TV, they're great. We didn't buy any ads on TV. So this was the great stories that we were doing through brand journalism. And oftentimes when we did brand journalism, what led us, we didn't have videographers until we created this program. And so we just were quite successful in creating great video content. And we had news channels there that were just like, we're so overwhelmed. We need content. Can we just take what you gave us and put the 9 News name on it? And I was like, absolutely. What a beautiful way to control the narrative. So that was kind of one of the ways that I would say. And then the other way that really, for being a university and what helped us was, you talked about, like your doctors and the expertise there. We did that a lot with our faculty. Because being a regional comprehensive university, you're not an R1. And so it's like, how do you really share the real world faculty? And we did it through a lot of brand journalism stories. But I would say in 2015, 2016, social media was something that our content was okay. It was more like cute pictures of students. And, it just wasn't. So brand journalism really helped us with our strategy for social media. And I think that is something that today, I would just say MSU Denver is top notch for their social media platforms. I mean, they have so many followers and there's just great content. People are repurposing it all the time.
Yeah.
So definitely a lot of similarities.
Yeah. Well, thank you for that. I know we're wrapping up here. Any other questions for us from any of you? I appreciate all the comments. Been a good discussion. Anybody want to ask anything else? All right. Well, then I'm gonna flip it back to Kristen. Kristen, take us home.
All right. We're a little over time. Thank you all for staying with us. I'm going to share a recording from today. Thank you to Steph. Thank you to Jim. Thanks to everybody who participated. We appreciate it. I put my email in there, but you'll hear from me. I'll share the slides, some bonus materials. If you have any questions or want to connect, please let me know. And thank you again for joining us. Keep us on the loop here for future sessions that we host, coffee and conversations on different topics, and tell your friends.
All right.
Thanks everyone.
Everybody. Thanks for coming.
Bye.
Bye-bye.